Well, today being Thursday, we're joined now by In Focus health correspondent Lindord Moudou. And I'm aware that the fight on H1N1 is on.
Yes, it is on.
What is the latest?
Well, we know that there is a vaccine on development. When testing of the new vaccine for the H1N1 swine flu began, experts believe most adults would need 2 doses because it is a new virus. But 2 new studies show most adults are protected after just 1 dose. Voice of America's Carol Pearson reports on the implications this has for the H1N1 pandemic.
Health officials battling the first flu pandemic in 41 years got some good news recently. Just 1 dose of vaccine appears to protect most adults. U.S. Secretary of Health Kathleen Sebelius said the news was encouraging.
It now appears that most of the folks have a robust immune response in 8 to 10 days from the date of the first vaccine, which is very positive news.
There you go.
A U.S. vaccine study has proven to be just as effective as a vaccine trial in Australia. The news is surprising and welcome.
1, 2, 3.
With more vaccine available, this means the H1N1 vaccine can inoculate twice as many people throughout the world. Dr. Anthony Fauci is with the U.S. National Institutes of Health.
In essence, it mitigates some of the problems that we're talking about when you talk about decreased, or not decreased, but inadequate supplies for everyone.
U.S. health officials say 98% of the flu cases they're seeing are caused by the H1N1 virus. The vaccine should be available by mid-October, but schools are already open. The weather is turning cooler, and the flu season is underway in the Northern Hemisphere. 60 students have come down with the virus at the University of Minnesota campus in Minneapolis. Some are concerned.
And just really hearing that it's going to expand and maybe explode on college campuses is scary.
In the meantime, health officials are urging people to get the seasonal flu shot, which is available now. They recommend that people be immunized for H1N1 separately. Health officials say those in high-risk groups should be among the first to be vaccinated. Pregnant women and children, young adults, people with chronic medical conditions, those who care for young children and healthcare workers. Results of trials involving children and pregnant women are expected in a couple of weeks. Carol Pearson, VOA News.
And Africa isn't immune to swine flu. Nearly 50 people have died from the disease in South Africa, including a doctor in KwaZulu-Natal earlier this week. There also was a death in Mozambique. And joining us by phone from South Africa is Professor Adrian Puren. He's a deputy director and head of the Virology department of the National Institute for Communicable Diseases, South Africa. Professor Puren, welcome to the program.
Hello, good day, and thank you for having me on your program.
Let me have your thought on the rate of infection in South Africa. Almost 50 deaths and thousands of people are reported infected. Tell us what is going on.
Yes, I think in South Africa, what we're seeing mirrors what has happened in various other countries. When you look at, say, the United States or Europe, for example. In other words, we started off fairly slowly. It was the end of our winter season in SE in a way, and we'd seen a decline in the number of seasonal flu cases. And then what had happened here was that, and primarily because of travel, we started to see cases early on in June. And what has happened is that in South Africa, this virus, the pandemic virus, has become really the dominant virus that we're currently seeing in circulation all over the world. So in other words, it's displaced our seasonal virus, and it is the dominant virus. So although we have over 11,000 laboratory-confirmed cases in South Africa, as you quite correctly say, it's likely that there are many, many more individuals who are infected, but because the illness is relatively mild, I suspect the majority of people either had symptomatic treatment at home and or were not tested. So I think we need to put the context of the deaths in this sense, in that it's, as I said, multiple or thousands of individuals have been infected, but to date we only know of 47 recorded deaths.
Now,
Again, when we look at those deaths, if I may just conclude on that, is the high-risk groups. In other words, pregnancy being the major risk factor, and this mirrors what you've seen in the United States, for example.
So how did we go from seasonal flu to H1N1? To what would you attribute the emergence of this virus in South Africa?
I think it's what was seen all over the world. When you have the start of a virus that was never seen in the human population, and it's transmitted easily from one individual to another, you see this very rapid spread that you've seen in the United States and Europe and all other countries in the world, that this virus has spread very efficiently from one individual to another. And of course, nowadays with travel, that certainly makes that spread even faster than what we expect to see. So it's not unusual to see what we've seen in South Africa. And I suspect in the rest of Africa as well, depending on the conditions, especially the climatic conditions and social conditions, again, you may well see the rapid spread. And we've seen already the NICD has supported some of the African countries in terms of their testing. For example, Namibia, Botswana, Mozambique. We've certainly been supporting those countries, and we can already see that there are an increased number of cases in those particular countries.
And tell us what is being done in South Africa as far as preparedness to ensure that there is no more catastrophe. Well, we will not say catastrophe, but no more new infection.
Well, I think it's very difficult because this is a virus that has never been seen before, and therefore there's limited immunity. There's the sorts of things that you can try and emphasize in terms of trying to reduce the spread is, for example, good hand hygiene, cough appropriately, sneeze appropriately into your sleeves, and so on. But it becomes very difficult to spread to stop the spread of the virus. So again, South Africa did not follow some of the trends because we followed the WHO advice, and that was not necessarily to close businesses or close schools, but just to treat each scenario on an individual basis to try and prevent that. What we've also tried to do in South Africa is to try and ensure that Tamiflu was available, especially for high-risk groups. And the testing as well was really can become quite burdensome. So again, we try to develop guidelines, and we share these guidelines because they also derive from WHO guidelines with other countries around in the African continent. So guidelines, trying to ensure that we treat and identify cases appropriately was our key strategy. In other words, we have a surveillance system in South Africa that looks at the general population, but also hospital-based populations, to see how the disease is spreading and what burden that will have on the hospitals. So fortunately, as has been the case all over the world, the disease has been mild. But yes, there have been hospitalizations, and we need to keep a sharp eye to see what will happen with this particular virus as we go through our summer period, but then the winter will arrive. But will this virus be as mild as it's been now, or will it change? And therefore that will have implications in terms of hospital-burdened cases.
Okay, Professor Puren, and that's all the time we have for today. Thank you so much for joining us from South Africa.
Absolute pleasure. I hope that was helpful. Thank you.
Okay, and that was Professor Puren from South Africa.
Indeed, very helpful, but apparently it looks like each of us needs a lot of information as to how to stop the spread of this
Absolutely, it's all about awareness and prevention.
So there's a lot of education necessary out there. I want to thank you very much, Lindord.
Indeed.
And for our viewers, please don't forget to join Lindord Moudou every Tuesday and Thursday for the latest news on health.